Hi, I'm Ralph Stevens. I'm here in this video to show you some new strategies to help people that are in low back pain using a massage chair. Now, my contribution to chair massage is that back in 1995, I introduced the therapeutic paradigm to chair massage, which prior to that had been strictly a relaxation, more of a choreographed routine type of approach to chair massage. But I've been teaching sports massage and medical massage and always have had a clinical practice, and I just somehow couldn't limit myself to a relaxation routine in the chair. So I introduced a therapeutic paradigm to the chair that I called seated therapeutic massage. I have a series of videos called Seated Therapeutic Massage, and Volume 1 is on the back and neck to help people with low back pain using the chair. Volume 2 is the shoulder girdle to help with all sorts of shoulder problems from rotator cuff injuries to thoracic outlet syndrome. And I also have Volume 3 for forearm, wrist, and hand for carpal tunnel syndrome, golfer's elbow, tennis elbow. We'll talk more about that in another video clip. I'm at the Oakworks studios today, and we're going to be using their brand new massage chair, the Portalite. And I'm really happy with this chair. I think it's one of the nicest chairs on the market right now. It's very economical. It only weighs about 15 pounds. And it doesn't have a whole lot of unnecessary adjustments on it. It's got everything you need to do great chair work at a very great price and a very compact, quick, and portable. So I'm going to be using this chair. This is now my favorite chair on the market, and I'm very happy to be here and endorsing this chair right now. Now I'm going to bring, now one of the things about low back pain is one of the worst things somebody with a back spasm or acute low back pain can do is lay down on a table and get back up. But on a massage chair, they can just sit down on the seat and it's very easy on their low back. Then you can get their muscles calmed down and either get them on a table or many times provide them the necessary relief in the seated position. So I'm going to show you a couple of tricks to work on the two major muscles that contribute to low back pain, the Quadratus Lumborum and the deep paraspinal layer called the multifidus. So we're going to bring Brendan in now. And Brendan, normally in chair massage, of course, we work through the clothes. But so that you can better see what I'm doing, I have him take his shirt off today so that you can see exactly where I am on the tissues. Normally, of course, we would be working through the clothes. So we're going to start with the Quadratus Lumborum. We're just going to warm the tissue up. I'm going to take the knife edge or the ulnar side of my hand. I'm going to make contact and place it gently into the waistline in between the ribs and the ilium at about a 45-degree angle to his body, and gently, just a light to moderate pressure, do a circular friction here to warm up the tissues of the Quadratus Lumborum. And then I'm going to step to about a 45-degree angle to his back in the lunge position, my thumbs in nice body mechanic alignment, starting at about the coronal plane line of the body. I'm going to make contact with the inferior aspect of his rib. So if this is a rib, I'm working along the inferior aspect of it like that. And with a medial stroke, I'm going to work along, and here's the tip of his 12th rib right here. I'm going to work medial, medial, and right here I'm encountering a very firm structure that stops my medial progress. That's the transverse process of L1. Notice how far lateral I am. Here's the other side. That's how wide the living spine really is, and Quadratus Lumborum is laying clear out here like this, narrower at the top than at the bottom. So now I can examine the transverse processes, bracing my thumbs for good protection of my thumbs, and check out the transverse process of L1. That okay, Brennan? Yeah. Tell me when I find a tender place if I do. One thumb down is L2, one thumb down is L3, and then we hit the crest of the ilium. I can't quite get to L4 on Brennan, and many people you can't get there at all. I can just barely feel the top of it here. You won't feel these as distinct little points. It will be a solid line because the spaces between the transverse processes are filled in with the intertransversarii muscles and other tissue there. So it's going to feel more like a hard line down. When I get to the crest of the ilium, I'm going to rotate my wrist and step in a little closer and press straight down onto the crest of the ilium. So if my hand was his ilium bone, I'm going to be right on the superior aspect of the iliac crest. And with a lateral medial stroke, I will work back and forth across fiber on the Quadratus Lumborum on the crest of the ilium and in and out, anterior, posterior, and examine this attachment and work my way out to the coronal plane line, or the midline of his body here. So that's Quadratus Lumborum. This muscle is involved in 2/3 of all low back pain. If I could only do one muscle in the low back, that'd be it. Of course, I wouldn't limit myself to that. The second muscle is we're going to work through the iliocostalis layer of the erector spinae superficial to the deep layer called the multifidus. To do that, I'm going to move around and come to the straight, almost straight lateral from his body. Here's his big erector spinae. I can just move my fingers lateral till I feel I'm dropping off the edge of the erector spinae and push back medial at a 45-degree angle into the edge of the erectors. I could also come from Quadratus Lumborum and move superficial or posterior till I feel the edge of that softer tissue as opposed to the hard osseous tissue of the quadratus transverse process layer. So in other words, here's erector spinae, and the Quadratus Lumborum is lateral and deep to them. I'm going to press right into this edge of that erector spinae muscle. This okay? Okay. And I'm going to work cross fibers, which is more or less lateral medial and inferior superior, examining these tissues, working inferior a thumb width at a time down to the crest of the ilium, and work back superior up onto the ribs, where we lose this big thick multifidus into its little diagonal strips that run transverse to spinous process, and what we then feel, this big band up on the ribs, becomes the longissimus muscle of the superficial erector spinae. This is where that deep ache in the low back that used to be called lumbago, that's still a term in the medical dictionaries. My grandma used to call this lumbago. So if I can work those two muscles and then do some general work on the erector spinae here with my fingertips, rocking them gently in the chair, that would not be good for a disc injury, but for most people it's very relaxing. And this is a really nice treatment to the low back. I would go to the other side, and as you can tell, this doesn't take very long. So that's a real nice way to do some great low back work in the chair. If you'd like lots more specific information on how to do therapeutic work in the chair, please check out my website, ralphstevens.com, www.ralphstevens.com. I have live seminars in this work. I also have a complete set of videos, and I would love to share this information with you so that together we can help more people that are in pain using the massage chair. Thank you so much for watching this video. Be well.